So welcome to the class. So today's topic is about perineum. Okay. So what is perineum? It is a diamond-shaped space of the bony pelvic outlet. It is divided into two triangular spaces with common base, which is formed by the free border of urogenital diaphragm. The anterior triangle is called as urogenital triangle, which fills up the gap of the hiatus urogenitalis and is important from obstetric point of view. The posterior one is called as anal triangle. So you have two triangles. Anterior one is a urogenital triangle and posterior one is a anal triangle. Okay. So here you can see this is the anterior triangle. This is the posterior triangle. Okay. This is the urogenital triangle and this is the anal triangle. Okay. Now, what are the boundaries? Let's see the anatomical boundaries. Above, there is the inferior surface of the pelvic floor. Below, it is the skin between the buttocks and the thighs. Laterally, it is bounded by the ischiopubic rami, ischial tuberosities, and sacrotuberous ligaments. Okay. And posteriorly, it is the coccyx. So, these are the boundaries of the perineum. Then coming to the urogenital triangle, that is the anterior triangle. It is pierced by the terminal parts of the vagina and the urethra. The small perineal muscles are situated in two compartments formed by the ill-defined fascia. So there are two compartments in the urogenital triangle. These compartments are nothing but the superficial and the deep perineal pouch. Okay, the superficial perineal pouch is formed by the deep layer of the superficial perineal fascia, that is the Colles fascia, and the inferior layer of the urogenital diaphragm, that is the perineal membrane. Okay. Now, what are the contents of the superficial perineal pouch? The contents are the superficial transfer perineum, that is paired muscle, then bulbospongiosus muscle covering the bulb of the vestibule, then ischiocavernosus, again it is a paired muscle covering the crura of the clitoris, and the Bartholin's gland, which is also paired. So these are the contents of the superficial perineal pouch. That is the superficial transverse perineum, which is paired. Then there is a bulbospongiosus covering the bulb of the vestibule. Then there is a ischiocavernosus, which is paired, covering the crura of the clitoris, and the Bartholin's gland, which is paired. Then coming to the deep perineal pouch, it is formed by the inferior and superior layer of the urogenital diaphragm, together called urogenital diaphragm or triangular ligament. Between the layers, there is a potential space of around 1.25 centimeter. This is the deep perineal pouch. The contents of the deep perineal pouch are the muscles, that is deep transverse perineum. It is a paired, and the sphincter urethrae membranaceae. Both the pouches contain vessels and nerves. Okay, so deep transverse perineum are located into the deep perineal pouch along with the sphincter urethrae membranaceae. Okay. Now coming to the anal triangle, it has got no obstetric importance. It contains the terminal part of the anal canal with sphincter ana externus, anococcygeal body, ischiorectal fossa, blood vessels, nerves, and lymphatics. Okay. Now coming to the obstetric perineum, what we have seen is the anatomical perineum up till now. Now coming to the obstetric perineum, also called as perineal body, central point of the perineum. These are actually the short notes for MS candidates. Okay, there can be short note on perineum, there can be short note on the pelvic floor. So this is what you are supposed to write. Then coming to the obstetric perineum, the pyramidal shaped tissue where the pelvic floor and the perineal muscles and the fascia meet in between the vagina and the anal canal is called as obstetrical perineum. So it is a pyramidal shaped tissue where the pelvic floor and the perineal muscles and fascia meet in between the vagina and the anal canal is called the obstetric perineum. Dimension is, it is a 4 by 4 centimeter structure with the base covered by the perineal skin, and the apex is pointed and is continuous with the rectovaginal septum. Okay, so size is 4 by 4 centimeter, is covered by the perineal skin, and the apex is pointed and is continuous with the rectovaginal septum. Okay, now coming to the musculofacial structure involved. So fascia are two layers of the superficial perineal fascia, that is superficial fatty layer, and the deeper, that is Colles fascia. Then inferior and superior layer of urogenital diaphragm, together called triangular ligament. Okay. Then coming to the muscles, you have superficial and deep transverse perineum, that is paired one. Then you have bulbospongiosus, levator and a pubococcygeus part, that is paired. Then situated at the junction of the two-third and lower one-third of the vagina. that is the pubococcygeus part. Then sphincter ani externus, few fibers of the that these are the structures involved in formation of this obstetrical perineum or the perineal body. Okay, what is the importance? It helps to support the levator ani, which is placed above it. Okay, then by supporting the posterior vaginal wall, it indirectly supports the anterior vaginal wall, bladder, and the uterus. Then it is vulnerable to injury during the childbirth, and deliberate cutting of the structures during delivery is called as episiotomy. Okay, so that is what is the importance of obstetric perineum. Okay, thank you.